Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. I was a dentist for 25 years, now doing the dental practice brokerage for 16. Today's topic is two dentists buying a dental practice. Only one hits the ground running. I'll tell you that story. So as you know, we have 10 employees, 2 CPA accountants, marketing director, operations director, and a couple of development acquisition specialists. So we are working every day, except Christmas and Easter, and we're here to serve you. Our number is 201-663-0935, and the website is dentalpracticeguide.com or nationwide dentalpracticebrokers.com. So call us anytime. Be more than happy to chat with you. Everything you're about to hear is for entertainment purposes. It's not legal or business advice. So if you have a large practice also, you might be a candidate for the DSO buyers, corporate buyers. They're still buying nowadays. You got to be a little more careful now. You want to stick with the bigger ones. But they're buying, and they offer top dollar. But you have to work for a couple of years for them, certainly, and you don't get all your money up front. But some docs have done very well with them. So it's something you may think about. And some of them will pay our commission. So often you could be in there with no commission. So that could work out real nice for you. Give me a call. We'll talk about that. Now, if you do have a big practice that you are selling, hold on. So continuing, if you have a practice doing over $1 million, 4 or 5 operatories, and you're willing to stay, work a little bit for them, it works out well for the DSOs. And then if your practice you're selling and we're representing it, it's over $1 million, upon successful closing, we will reimburse your legal fees based on some small criteria, like you have to use a well-qualified, recognized dental attorney. But we've done that many, many times. So let's get to today's story. You got these two dentists, right? One is a go-getter, hits the ground running. The other is like 6 weeks, is still reviewing the non-disclosure agreement, because all my buyers sign a non-disclosure NDA confidentiality agreement. 6 weeks, this guy calls me, or gal calls me, with their attorney on the phone. So this is the slow doctor. Says, we want to review your letter, your non-disclosure agreement. We think it has to be altered because it's too vague. I'm like, what's the problem? It's only like a non-disclosure. It's not a, Oh, no. I said, it says right in there you can speak to your attorney, your bank, your accountant. There's no problem. You can speak to a family member. It's all there. What do you want to change? They have this minutia. They're going on with me for a half hour of the minor changes they want to make on my non-disclosure agreement. This doctor talked to me 6 weeks ago, 5-6 weeks ago. And now with their attorney, they're on the phone with me, these changes. I'm like, are you kidding? Why are you wasting your time in this? This is minutia. It's like, this is nothing. A broad, you think the, the non-disclosure is too broad-based? It's like, I can't believe this. I said, you should be pursuing the practice. And this is about a 30-minute conversation of the points they want to change. I said, hey, whatever you want to do, we're here. We'll take care of it, but you have to focus on the practice. This is a seller's market, not a buyer's market. Not that you have to rush into anything, but you're wasting 6 weeks reviewing my non-disclosure agreement. It's so foolish. What you've got to do is get this thing over. Let me know the changes. I'm sure we'll agree to it and get this show on the road. Not 6 weeks reviewing, discussing, getting the attorney involved for a non-disclosure agreement. It's like, give me a break. I mean, I realize, too, this is a big step in a doctor's life. Probably never bought anything besides a car at all. And this is the biggest financial step in their life. Agreed. But I just can't believe how this went on. This conversation went on for a half hour, telling me about line by line. I'm like, I can't freaking believe this. I tried to stop him 2-3 times in the middle and say, we should be focusing on the end goal, which is to get you a practice. It's taken you 6 weeks to review my non-disclosure agreement. Are you kidding me? Opportunities can be coming and going while you're wasting your time on this minutia. I think they got the message after a while that they're wasting their friggin' time. It's like, get the show on the road. Yes, you have to protect yourself. Yes, you should speak to professionals. Agreed. But you've got to focus on the practice. When you're ready, you could have a great practice that comes on the market and just disappears. And you're still reviewing my non-disclosure agreement. It's like, give me a break. This is what you got to do in this business. You see a practice you like, rapidly investigate it. Just investigate rapidly. Get all the paperwork, make your analysis. Whether you want to pursue it or not, you don't move on to the next deal. And then move on to the deal after deal after deal until you're satisfied and your professionals are satisfied. But don't waste your time on minutia. Just move on. There's just not as many available. And then as you move on, you may notice the first one you saw is one of the better ones. Every practice has some issue with it. Every practice has something wrong with it. Nothing is perfect. No deal is perfect. There's got to be something you're not happy with. But it's a seller's market. So what are you going to do? You've got to buy something that hopefully that you're satisfied with. If not, you could work there a few years and sell it until you find your dream practice, or dream practice, so to speak, dream practice. So please check that out. Don't get yourself crazy. Expedite, learn whatever you can as fast as you can. Realize you're wasting your time. 6 weeks reviewing a non-disclosure agreement. Now, the other doctor, listen to this one. She was a go-getter. She was tough. She focused. She knew exactly what she wanted. I even had a practice that had just come on the market. We didn't have the data yet because I just met the doctor a week ago. She said, whatever it is, let's look at it. Give me the financials. I don't have to, give me whatever financials or whatever you have. Give me some parameters. I'll run it by my bank. I'm pre-approved for a loan. This doctor, she hit the ground running. I mean, running. She was tough. And this is the way, I think you should be. Not that you're falling into something or jumping onto something you're not ready, but what she did was rapidly expand everything, rapidly. She was even a real go-getter. If I'm not mistaken, she was the buyer. I think she told me, I'm going to pay your commission. Get on top of this. I mean, she was so tough. I loved her. I'm going to pay your commission. Historically, the seller always pays the commission. We don't ask the buyer for commission. But she just said, I want to get this rolling right away. I want you in my corner. Please get it rolling. And if we tell the seller that I'm paying the commission, maybe it'll, get them even more motivated. So she did great. I mean, she just was a shark. We tell the seller, listen, we have a buyer that wants to pay the commission. Historically, always the seller pays it. I said, she wants to get in here as soon as possible. I realize you don't have all the financials, but this buyer is motivated. And she got the deal together. I was proud of her. And the other guy, he's still getting it together, Now, I went over this. It's already been a week since we went over the non-disclosure agreement. And I guess he's still getting his act together. He's going to review. The weekend's going to go on. He's going to review the changes that he's going to send in. Those changes I didn't get yet. But this is like a big deal to this guy. I understand. I'm not trying to push him into anything. So maybe he'll be ready Monday next week. I don't know. And then what is he going to do? He's going to make a presentation, and that's going to be a big deal. He's shaking in his boots. Can't do that. You got to move on this stuff. You like something, just move on it. I know you're not ready. Hey, I was out. There was some procedures I was uncomfortable with. Get the oral surgeon to do it. It's a big roundhouse. You weren't experienced with one. Get the prosthodontist to help you out. But that's what you got to do. One hits the ground running, and the other's still researching after 6 weeks, going on 7 weeks, my NDA non-disclosure agreement. It's like, get it together. All right, and that's what you got to be. And you can choose a path. If you decide to move very slowly and that keeps you happy, hey, that's okay. But I think you're wasting your time if you go that route. All right, team, we are looking good. I'm leaving next week. I think it's Tuesday. I'm leaving for the cruise seminar. This is the almost 19 days to Vietnam, Japan, China, Hong Kong, Japan. We're all over the place. Singapore is supposed to be beautiful. But on the cruise ship, will be a 14 or 15 day on the cruise ship. That's going to be really nice. We're going to have plenty of lectures going on, communicating one-on-one. This is like the cruise we did in January, on January 12th. Now, the next cruise coming up after this one, I believe, is going to be January of 2027. That is, I've already booked. I already got the suite ready. That's going to be a good cruise, too. That's going to be... and don't remember, we have the continuing education credits. I've been accredited by the Academy of General Dentistry. So these things are deductible for you. But you will get some valuable information, question and answer. I think you're really going to like it. All right, team. Time to roll. Summertime is coming. I can't wait. Talk to you soon. Bye.